Hey everybody, it's Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to go over a very common question in regards to gum grafts and do gum grafts hurt? Or how painful are they? So before I go into that, if you guys can give me a thumbs up on this video and you find this information helpful, if you give me a follow on our YouTube channel, North Texas Dental Surgery, that'd be greatly appreciated. Alright, so do gum grafts hurt? Well, that's honestly a very common question, and in fact that there's a very big stereotype associated with gum grafts. So we have several other options too that you guys can look at if you're really worried about gum grafts being painful. But there's several different types of gum grafts, and the reason I should go into that is because they each vary significantly in regards to pain. So free gingival graft, which is very seldomly used. It's used for grafting on the lower front teeth. I'd say that's only about 5% of the patients that ever come into a practice ever need that type of procedure. If you get that, to be honest, yeah, it is kind of painful. A lot of patients say on a scale of 1 to 10 that it was about a 6 or 7. Usually from the roof of the mouth and the way that we get that surface tissue. So a lot of patients will complain about that. Again, it's only a few days, and also we give you painkillers. Typically we give you ibuprofen, also hydrocodone too, so if it should definitely be good enough. Also, if you do get a free gingival graft, what you definitely want to consider is getting something called a palatal stent. It looks kind of like an Invisalign tray that you put on the roof of the mouth, but it helps significantly with bleeding and also pain on the roof of the mouth, so I would highly recommend that for you guys. Another thing is basically connective tissue grafting. That's another type of gum grafting, right? So connective tissue grafting pain is way less. So I like to tell patients that they tell me, I've asked for years, I've done thousands of these, scale of 1 to 10, what was your pain experience for doing a connective tissue graft? A lot of people say 1 or 2 out of a scale of 10. Some people say 0 and they never even took ibuprofen after the procedure. Some people say 3 or 4, but most people say 1 or 2. And the reason it hurts a lot less is because the way we get the tissue from the roof of the mouth is way less invasive. We're grabbing the middle tissue layer, the connective tissue from the roof of the mouth. So that hurts way less, and therefore patients are way more satisfied with the procedure. So again, that's typically about 95% of the patients that come into practice. They'd be candidates for connective tissue graft. Now, if you're fearful of going to the roof of the mouth at all, we have another option for you, and that's basically called the pinhole technique, or using alloderm. And the reason why it's less painful is we don't have to go to the roof of the mouth at all. Okay, so no pain from the roof of the mouth. Now, when we transplant that tissue down to your affected teeth, obviously you can get a little discomfort from that area too. So people typically say on a scale of 1 to 10, it was about a 1 or 2 also. So it's very similar in regards to connective tissue grafting. So you get a great result, but also you get significantly less pain. So I would honestly say that connective tissue grafting, using alloderm, using pinhole technique, they're all pretty synonymous with each other. So just keep in mind though, like if you do use alloderm, human donor tissue, or the pinhole technique, which is using the same stuff, you're most likely going to have a higher associated fee with it, because your surgeon's going to have to buy extra materials for you to get that gum graft. So there's a higher overhead cost for your surgeon. So just keep that in mind. But if you're interested in getting as least pain as possible, then that's that. Now let's talk. That was all post-operative pain. Let's talk about actual surgery pain. So before we do any procedure like this, we got to numb the affected areas where we're going to graft, and also if you're going to get the tissue from the roof of the mouth, we got to get that tissue also. We got to numb you up there. So because of that, just know that we do have to numb you up in those areas, and you can have some associated pain with that. If you want, you can also have your surgeon potentially give you IV sedation. So IV sedation is fantastic because they can sedate you, it's very safe, you're not going to remember anything, you sleep through the procedure. So I always want to talk about that too, in regards to patients are going to ask, well, is it painful? Is the procedure painful? The procedure is not painful at all, because you can go to sleep, they start numbing you. Numbing you is the worst part of the procedure. But after that, honestly, you're not going to remember anything once that IV starts. And then when you go home, then you might have to deal with a little bit of post-operative discomfort. But again, your surgeon should give you pain meds. Typically what we give is ibuprofen and hydrocodone. So hopefully that information was very helpful for you guys. But if you guys have any other questions, please feel free to leave them in the comments below. Thank you.